My name is Tiffany Law. I am the program manager with the Inland Empire Community Health Initiative. The Inland Empire Community Health Initiative, or the IHI, is kind of an interesting situation, as essentially we are one of 27 other CHIs throughout the state of California. And one of the stories that come to mind really highlights not only the necessity of being culturally safe and person-centered, but the importance of having a network of support. About last year, I want to say, we had a call come in from our San Diego neighbors. And they had someone who was in dire need of support in doing an inter-county transfer. Now, inter-county transfers are essentially trying to get your benefits moved from one county into another, right? So pretty straightforward, but it can be a really long and tedious process, especially for someone who doesn't or isn't very in the know about the healthcare industry, and maybe a little confused on why they necessarily have to. But we find that with our neighbors in San Diego or LA or Orange County, the same healthcare coverage options aren't always available. So we know here in the Inland Empire, we have Molina, we have IHP, we have now Kaiser as well, but those same options aren't available in other counties. So it is really imperative to do that inter-county transfer. And sometimes people just need a lot of support in getting that done. When it comes to this specific situation, the San Diego County partner that we have called our interim executive director to get some direct support. This person was calling on behalf of, I believe, their daughter who had significant disabilities and had just transferred up to Riverside County. And they were having a hard time being able to acquire their medication because of this inter-county transfer. So they were kind of in distress. They were unsure because they were now in a new area, and they were still in San Diego County while their daughter had moved away. So they were really kind of unsure of what exactly they needed to do. And also they were in a state of alarm because they needed these medications, right, to continue to support their daughter. So we were able to get on the phone with our partner organizations in Riverside County, let them know what was going on, let them know of the general area, and they were able to reach out to the parents, connect with the daughter, do a check-in with her and see how everything is going, and then get that inter-county transfer completed. Once that inter-county transfer was completed, they reached back out again, ensured that they had been able to pick a healthcare plan, ensured that they were able to get their medication switched over to a closer pharmacy, and had essentially created a huge wave of relief for this family who was just trying to get something that they thought would be really easy to get done, completely done. So yeah, it was a great opportunity for us to kind of see the impacts of the network of supports that we have in our partners, but more importantly, how the education when it comes to health coverage and health insurance, and specifically these inter-county transfers, is so necessary for people throughout both of the counties that we serve. So what we learned from this experience specifically was the connections throughout the counties that we neighbor with have a huge impact in us being able to properly serve our communities. I believe it was ITUP, or ITCHUP. I can't remember exactly what the acronym is, but they provided a report that said that Riverside and San Bernardino counties should be growing by 6 or 7 million people throughout the next few years. And with those people come in their needs, their support requests, and specifically these inter-county transfers that could be happening. So it's really important for us to be able to know the other tries to know the other resources within our county and outside of our county, because sometimes these tedious changes have to be done quickly and effectively. Because for the individual people that we're serving, it's not just a paperwork issue, it's someone's access to ongoing health. So it is incredibly imperative that we have these meaningful connections with agencies inside of our county and outside of our county.